Welcome back. It could mean a big shakeup in the push to get more Americans fully vaccinated against COVID-19.
Yeah, the Food and Drug Administration has granted the Pfizer vaccine full approval. Previously, it was only authorized for use due to the health emergency. The Moderna and the Johnson & Johnson shots remain under emergency use as well. The emergency use authorization has been used as a reason by some to not get vaccinated or to stop short of vaccine mandates. So what changes with the new authorization? Joining us now, FDA vaccine advisory panelist and infectious disease doctor at Children's Hospital of Philadelphia, Dr. Paul Offit. Thanks so much for joining us.
Good morning.
All right, so what was the holdup with this? And now we get this full FDA approval for the Pfizer shot. Do you think we're going to see those vaccination rates go up?
I hope so. I mean, there was a Kaiser Family Foundation study that asked those who were not being vaccinated why, and 3 of 10 said that they weren't being vaccinated because they were waiting for full approval. Okay, so now you have full approval, and we'll see whether that makes any difference or whether that 3 out of 10 people are just going to come up with a different reason for why they don't want to get vaccinated.
And talk about some of the other shots as you are on the FDA advisory panel here for these COVID vaccines. When can we see Moderna, the other ones as well, get full FDA approval? Is that going to take some time as well, or is this coming rather quickly?
Well, it should come pretty quickly. I think the difference between emergency use authorization, which is basically allowing the pharmaceutical companies to distribute an investigational new drug, and full approval or licensure, really has to do with that you don't just license the product, you also license the process, and you license the manufacturing site. I mean, these are biological, so the process is the product. And so you have to validate every aspect of manufacture, and that usually takes about 10 months to a year. Here it was done in about 4 months, which is actually pretty quick. You know, in reality, this shouldn't make any difference. I mean, we already know the vaccine's been given to half of the American public. It's safe, it's effective, it's being manufactured consistently. We also know that many groups have already mandated this vaccine, even under emergency use authorization. But it looks like there's been a rush to mandate the vaccine now from another number of other places, so that's good. I mean, hopefully we'll vaccinate those people who are unvaccinated, which is the big problem right now with getting control of this pandemic.
Yeah.
Dr. Offit, what about vaccinating, say, 5 to 11-year-olds? When do you expect that will start happening?
I don't know. I know as much as you know. I mean, hopefully those studies will be completed and we'll have something by no later than late fall, because as we move into fall and winter, this virus is more easily transmitted. It's basically a winter virus. You're going to have the Delta variant, which is obviously far more transmissible, and you're going to have a lot of people in one place, children between 5 and 12 years of age, who can't be vaccinated. That's a recipe for a disaster. So hopefully we'll have a vaccine as soon as possible, and hopefully when we get a vaccine, people will actually give it. The fact is, we have a vaccine for 12 to 17-year-olds, and only about 30% of parents have given their children that vaccine, which is woeful.
What about also one concern that I read about was that full approval might cause sort of run on these booster shots, even though they haven't been widely approved for non-immunocompromised people. Are you at all concerned that people will sort of now rush out to try to get boosters prematurely?
They don't need it. I mean, the mantra from the CDC, which I think is the right one, is that we need to be able to find that this vaccine protects against serious illness, the kind of illness that causes you to seek medical attention or go to the hospital or the ICU or die. And this vaccine has consistently done that. The mRNA vaccines and the Johnson & Johnson vaccine have consistently showed excellent protection against serious disease. So we haven't crossed that line yet for the need for a booster, but I think, you know, you're right. I think that might happen. I hope not. I think the worst thing that could happen is people will say, okay, now that it's licensed, I can now use it off-label and then vaccinate their 5 to 12-year-old when we don't have data yet that shows exactly how best to do that.
I know you mentioned that we don't need those booster shots if you're not immunocompromised or someone of really old age, but in your expertise in seeing this, we still don't know how long that protection lasts, whether it's for a lifetime, whether it's for a year, whether it's for 2 years. So do you think that we're going to see a situation where a couple years down the road we're going to be mandated to get those booster shots?
Yes, I think it's exactly what's going to happen. And hopefully the CDC will continue to look at people who are vaccinated and try and answer the question, when they're infected, what percentage of them are being hospitalized, as happened, for example, in that recently Provincetown, Massachusetts outbreak, where, you know, thousands of men got together in Provincetown, about 79% were vaccinated, but there was an outbreak. And of the 346 people who, despite being vaccinated, were nonetheless infected with COVID, only 4 were hospitalized, which is 1.2%. That was July. That was the Delta variant. So this vaccine is still holding up. But I think you're right. I think what's going to happen over the next year, 2 years, 3 years, is you're going to see that there's going to be an erosion in protection against serious disease, probably for certain groups, like the elderly, people with certain comorbidities, in which case you'd see a 3rd dose recommendation.
But Dr. Offit, do you think we're going to ever get to a point where this is more of an endemic rather than a pandemic? Because then what are you going to do? You're going to keep mandating booster shot number 1, number 2, number 3. How far do you go there?
I think we're going to have a highly protected population from vaccination or natural infection for years. I mean, think about it. You have 195 countries out there, many of which have not given a single dose of vaccine. The fact is we still give a polio vaccine every year in this country, even though we haven't had polio since the late 70s. The reason is because polio still exists in the world. I think that's going to be true for a long time with this virus. So we're going to need to have a highly vaccinated population for many years, I think.
Dr. Paul Offit, FDA Vaccine Advisory Panelist and Director of Vaccine Education Center at